We'll be talking about care in second trimester of pregnancy. Much demanded video from your side after my previous topic, which was care in the first trimester of pregnancy. That the entire duration of pregnancy is divided into three parts. That is the first trimester, the second trimester, and each trimester consists of 3 months. Now, second trimester is the turning point for the baby. Second trimester is also considered to be the honeymoon period of pregnancy. This is where the woman blossoms in her pregnancy. Why do we say that second trimester is important? Because there are major changes which take place in second trimester. That is, second trimester maximum growth of the baby and the period of organogenesis. That various organs are formed in the baby, and then these organs just develop and grow larger in size. Now, I'll be talking about problems that occur during the second trimester. So let me start from above, from the head to the toe. So first is regarding people are very particular. Many of my patients ask me, Doctor, my hair becomes very oily, my scalp becomes oily. Should I take wash my hair, or will it cause? Will I catch a cold, or will it harm the baby if I wash my hair many times? So the scalp becomes oily, and there is increased in the sebum production because of the hormones of pregnancy. So you can wash your hair as often as you want. Then the second thing is, what are the other symptoms? Sometimes a woman may experience headache as well during second trimester. This is again because of the hormone. It can also be due to lack of sleep or dehydration. So you have to take care to see that you're adequately hydrated, you're not hungry, and you have proper sleep. But if this headache is persistent, suppose every day you're getting this increasing in severity, or if it is associated with visual problems like blurring of vision, then you have to be careful. It could be. Then coming to nasal stuffiness. Few women complain of nasal stuffiness. This is because during pregnancy, what happens is the mucosa of the nose, it gets swollen, and because of that, the woman is nasal stuffiness. But this nasal stuffiness, which occurs because of hormonal problem, it should having a cold. Now, suppose you are not getting any watery discharge from the nose, and you're not having any other symptoms like sore throat, and your experience, then it is because of the hormones. So you can take for this problem, you can take steam inhalation, have a hot shower, which are available in the market. You can use it on the prescription of your doctor. Then the third thing is pigment. So some women experience some pigmentation on the face, which we call as the mask of pregnancy. Now this is because estrogen increases melatonin, and this melatonin causes pigmentation of the face, especially. So all most of the women get quite worried about it, but don't worry. This pigmentation will go away after pregnancy. Hereditary to some extent, like if the patient's mother has had cloesma in her pregnancy, then most often the daughter wants it. Then coming to bleeding from gums. So bleeding from gums occurs because of infection in the call as gingivitis. So because of this infection in the gums tend to bleed, and this is very common in oral hygiene is of paramount importance in pregnancy. It has been found out, or research has been done which shows that can also cause premature labor, or the woman can go into labor at an earlier date, or she can have the or premature rupture of membranes. So oral hygiene is very important. In fact, we tell all our patients who are planning to conceive this and take care of their oral health. Even if you are pregnant, if you are suffering some foul taste cavity or a toothache, it is always better that you visit a dentist. You have to inform the dentist that you are pregnant, and then he can take the required. Now, next is swelling of breast and breast pain. So, during pregnancy, especially during the second trimester, the breast release and the pigmented portion around the nipple, which is called as the areola, that will increase in size. The nipples will become more prominent. We'll also experience a little discharge, but there is nothing to worry about. This is all in preparation for to breastfeed the baby. Coming to the abdominal region, now this is the time when your tummy will show or the baby bump will show, and women sometimes feel very baby bump because they feel at that time during the second trimester they get that feeling that they are pregnant, and also that they have just come out vomiting and everything will decrease to certain extent. Now, baby bump or the baby bump, we say that are not. Some women feel that the baby may not be growing that well, and that is why it is not so prominent. I so many of the patients, relatives, the mother-in-law, the mothers come and tell me, doctor, इसका तो पेट ही नहीं दिखता है. So, is there anything wrong in the pregnancy, the baby bump, or the prominence of the tummy? So, it depends on the body size, the height. If it is of small build, most often the child also will be of smaller build. So, it depends on the height and the type of body, whether the patient, whether short or tall. So, as long as your gynecologist tells you the baby is doing fine, there is nothing to worry about. Then, why do stretch marks occur? Stretch marks occur because as the tummy increases in size, the skin over the tummy, and there are certain fibers called as collagen fibers in the skin. So they stretch to a certain extent and beyond a certain extent, and this causes stretch marks. So stretch marks cannot be avoided in pregnancy, but you can decrease the intensity by keeping the skin moisturized, and these stretch marks usually fade away after the pregnancy is over. So you need not go for even expensive creams. Whatever oil is oil or olive oil, you can apply on the abdomen and keep it moisturized so that the stretch marks will not become very. Also, there will be some pigmentation on the abdomen as well. Sometimes there's a dark line which goes from the umbilicus downwards. We call it. This is also because of the hormones which are produced during pregnancy, and this linea nigra, this dark line, does not indicate anything whether it is a boy or a girl, and so this is a myth. So it is just a normal phenomena which occurs during pregnancy. Then coming discharge, vaginal discharge sometimes happens during pregnancy. It is because of the progesterone and estrogen. The woman experiences are perfectly normal, but if the woman has curdy discharge or yellowish discharge, or it is associated with a lot of disease, has to consult her gynecologist. Also, if the woman experiences a sudden gush of fluid from the vagina, her dress gets very careful because it could be premature rupture of membranes, or if there is any bleeding, even if there is a drop of bleeding or even a you have to tell your doctor, because many women ignore this and they come for the नहीं लगा कि कुछ सीरियस होएगा. No, that is so you have to bring it to the notice of your gynec. Beginning of the fetal movements. So fetal movements are usually felt between 18 to 20 weeks. If you are, or if it is your first pregnancy, you will feel it a little later, that is between 22 to 24 weeks. So sometimes the women are saying that we are not able to feel the fetal movement. So if a woman is busy in her work, she may not notice the fetal movements as such. So when she's lying at night or lying down in the afternoon, she has to keep a watch over the fetal movements, whether the baby is moving properly or not. So women experience a sort of pain at the sides of the tummy, and they always say that जब मैं करवट लेती हूँ तो पेन ज्यादा होता है. That is ligaments in the body which hold the uterus in place. Because of the increasing size of the uterus, these ligaments get stretched and they cause so nothing to worry about. Then coming to urinary tract infection, a pregnant woman is very prone to urinary tract infection. A woman passes urine which is foul smelling, or she has to go very frequently, or if she is experiencing some burning sensation or feels to be a sign of urinary tract infection. Now, coming to a few other things like foot or swelling of the foot. So, sometimes in pregnancy, because of the weight, there could be a collection of fluid lower extremities, that is the feet, and the feet look very swollen. Now, suppose this edema or the swelling rest, then there is nothing to worry about. But suppose this swelling does not subside even after taking rest and it keeps on, it could mean that is a problem, and it could be an indicator of pregnancy induced hypertension. But suppose your BP is normal, but still to do, you have to elevate your feet when you're sleeping, or even when you're sitting down, you can just keep your foot on the stool of your foot so the edema subsides. So these are a few problems. Some women also may experience the greenish lines on their uh, feet. So these veins become prominent because of the increased blood flow during, also because of the hormones. So what to do if you have varicose veins? You can again elevate your feet, and you should not sit with your feet crossed. Another complaint at this point is backache. Now, backache of the lady and the abdominal muscles. The relation between the spine and the abdominal muscles is like the bow and the string. So, are pulled forward. There is tremendous pressure on the spine. So, how to manage backache? Backache whenever you're sit with a proper back support, and you should not wear high heels. You should always wear flat chappals or foot tendency. Because of your increasing weight, the center of gravity of the body changes. Moreover, you are not able to see the ground because of the size. And still, if the backache persists, then what you can do is you can apply local balms, or you can take a hot water, take some rest. Then coming to certain other things like diet. Diet, usually a pregnant woman should eat for two. No, that is totally wrong. Pregnancy needs just an increase in 100 calories. So eating for two or doubling your intake, there is no need for that. Concentrate more on the quality of food. Coming to sleep patterns, some women experience difficulty in falling asleep. They say that the fetal movements not fall asleep, and they are always feel tired. So, what is the solution for this is that you can try meditation, you can do some light exercise, and also reduce the screen time. If you're watching your mobile or if you're watching television, then the screen time sleep pattern. Coming to mental health is very, very important, and it is not discussed often. Little overwhelmed or depressed during pregnancy. So these symptoms should not be neglected. You can talk to your partner or you can. This is the best time to discuss with your partner sharing of responsibilities once the baby comes. Who is going to mind the baby? Who is going to do best time to discuss sharing of responsibilities with your partner? And if you repeatedly feel depressed or low, to your gynecologist. Do not ignore these symptoms. At the same time, try to keep yourself cool. Give yourself some me time. Time should be allotted for relaxation. Proper sleep should be there, and proper diet and exercise. About do you can go for a walk. You can do certain light exercises. If you are doing yoga, you can try that also, but twists and bend inversion exercises should be avoided. Coming to travel, yes, you can travel during your second trimester unless it's to take bed rest. You can travel during the second trimester. If you're medically advised to take bed rest, better to avoid traveling. It should not be like long journeys should be avoided. You can travel by flight, and you but bumpy roads should be avoided. Then coming to certain tests which we do during second trimester. First is your blood test. Your hemoglobin may be repeated in second trimester, even if TSH levels need to be repeated in second trimester to adjust the dose of thyroid. And there are certain in the second trimester, that is the anomaly scan. Now, this anomaly scan, I would like to give you certain tips for this anomaly scan. So, whenever a anomaly scan, please between 18 to 20 weeks, please get it done in that period only. Do not postpone it. There is, as I told you, that during the second trimester, the organs of the baby, there is a period of organogenesis, and these organs get formed during and that is why between 18 to 20 weeks, we always do the anomaly scan. This anomaly scan is to detect the baby. And what do we see in the anomaly scan? We scan each and every part of the baby, starting from the brain develop properly, whether the face of the baby is visualized properly, whether the baby has a nasal bone, whether the baby has the ears are normal, whether the digestive system is normal, the hands of the baby, the fingers, the digits, the heart, the kidneys, and the bones of the baby. So all these things and the spine, all these things are visualized in great detail. So, always forget your anomaly scan. Please do it on the date which your doctor has prescribed. Secondly, always take an appointment scan. Anomaly scan, the sonologist or the radiologist is doing it. He or she needs to spend a lot of time doing this anomaly scan. Responsibility on his or her part, and he has to see each and every part properly. And moreover, the baby is continuously moving. So the maximum time which is taken for an anomaly scan is between 30 to 45 minutes. So you have to allot that much. Third is always reach the center with a full bladder. Okay, because full bladder is necessary for the doctor baby. Fourth point is whenever you're going for an anomaly scan, see that you eat properly because it takes a long time. So you should not glycemic or hungry when you're sitting there waiting for your scan to be done. Another reason why we do the anomaly scan between 18 to 20 weeks is GP Act, and because of the government of India regulations, usually a pregnancy can be terminated only before 20 weeks. Terminate or if at all there is an abnormality. So beyond 20 weeks, it is illegal to terminate a pregnancy. So that is the reason why it's done between 18 to 20 weeks. Now, can we find out each and everything during anomaly scan? No. 80% of the can be detected by anomaly scan. But if your anomaly scan is normal, so rest assured your baby is normal. Along also advise a blood test called as quadruple marker. So this test also has to be done along with the anomaly. Then coming to immunization, yes, you can get your first dose of tetanus toxoid during the second trimester. You can for flu if there is a endemic of flu going around. This not only protects you but will also protect your baby. Then coming to COVID vaccination. Now this is a very problem, a common question, and many people ask me, Doctor, is it safe to take a vaccine during pregnancy? Association of Obstetricians and Gynecologists of India, of which I am a member too, we have advocated that pregnant women should take pregnancy. You can take it at any time during pregnancy, but the earlier the better. And the benefits of COVID vaccination far outweigh the risk. Doctor, are there any side effects if we take COVID vaccination in pregnancy? So, baby will not have. The mother could have a little mild fever, a little body ache, same as what other people have experienced. It will persist for a day more than that. So, get vaccinated for COVID. Plus, follow all the safety measures like wearing a mask and social distancing during. So, I think I'm done. Any questions? Yeah, about travel, I have already answered that question. Someone has asked, can I travel during second trimester? Yes, you can travel during second trimester. I'm 28 weeks pregnant. Doctor, baby's head is enlarged due to hydrocephalus. Kindly guide me. Okay, please consult your treating gynecologist because there are different grades of hydrocephalus, and the treatment will depend upon the grade. I cannot discuss that in great detail over here. Your gynecologist will tell you, but you have to make the decision before the child is born. Yeah, please talk about low-lying placenta in 6 months. Yeah, Lakshmi, you have asked me this question. Low, he's a little dangerous because what happens is the baby has to come first and then the placenta has to come. So low-lying placenta, if it is in the 6 month, you have nothing to worry because sometimes this placenta moves away and it comes back to the normal place. So if it is, you need not worry about it. Their further scans will tell whether the placenta is there only will remain in the same place or it has traveled up. In placenta, there are different types of low-lying placenta, or placenta previa as we call it, and there are different grades for that, whether it is near the or it is covering the opening of the uterus. So we divide into various grades. But since you have seen it in 6 months, there's nothing to worry about. But in case you have any, bring it to the notice of your doctor. So you have to keep a watch for that. And of course, you should not do anything strenuous work or strenuous exercise. What are the scans in the second trimester? I told you about the anomaly scan, which is the most important scan in the second trimester. Powder is prescribed in the 6 months. Whichever protein powder your doctor has prescribed, you can take. There are many brands in the market. Should I avoid eating in second trimester? So second trimester, there's nothing you can eat everything, but avoid outside food and otherwise you can have everything. And also fish which contains mercury. Brown discharge, is it normal during second trimester? No. Usually what happens is sometimes even the normal discharge is a little oxidized and it gives a brownish color. But still, it's better you get it confirmed from your gynecologist that it is not bleeding. Any more questions? And this session is coming to an end. Wish you all a healthy pregnancy. Enjoy your pregnancy to be great moms. Thank you.